Welcome to Dental Business RX. Practice success in 30 minutes or less.
Thank you for calling ABC Dental.
Outside of dentistry, there are very few businesses where scheduling plays such an enormous role in the business's profitability, efficiency, growth, or general stress levels. It's truly a case where how your schedule is constructed and how you run it can have everything to do with whether your practice is successful or fails. So we're going to dedicate this week's episode to that very subject, constructing a dental schedule, specifically how to create a profitable, efficient schedule that works for you. I'll be joined by Chris Menkhaus, who's the Practical Implementation Director here at MGE. Now, you may have heard Chris before in episode 14, which was how much a general dentist should produce per day. Now, Chris, to give you a little bit of an idea, is in charge of anything having to do with implementation and coaching at MGE. All of our power client managers work for and report to Chris. He's one of our more senior consultant types here at the company. He also has over 20 years experience in the dental industry. He's run multiple multi-doctor practices. As a matter of fact, the first practice that Chris helped build was doing $6 million a year, and the owner doctor did not have to be on site. So, Chris, we have you all set up over there. Welcome to the show.
Thank you. Excited to be here.
Yeah, so when we were talking about this episode, we thought the easiest way to go, because there's a lot to touch on with regards to the schedule, was, what would you do with a newer client? And you had a whole laundry list of, I think, like 7 or 8 points just that you would just go through, boom, 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 that our listeners can listen to and start making adjustments to their schedule. So I figured I'd just let you rip. Yeah? So
that sounds great.
Yeah, I'm a new client. I'm here. What are we talking about?
Great. Well, so the first thing really is what kind of practice you want to have. Now, at MGE, we're generally going to be patient-centric, meaning like getting your patients healthy, doing all of the dentistry they need to be back to health, and then coming every 3, 4, 6 months, like they, however you've designated they should come, right? Now, when you look at that, one factor you have to take into account is what type of insurances are you participating with, right?
Okay.
Because if you are a Medicaid provider or, for your state or possibly an HMO, there are times where that becomes very difficult to maintain that philosophy and that process, right? So that's part of the evaluation process. Like, what type of office do you want to have, right? And deciding to be patient-centric. Now, for our purposes, most of our clients, that is what they want to do. They want to be patient-centric. In fact, most dentists do. I mean, very few doctors just got into the game for money, right? Most people got in because they wanted to help get people healthy.
So you don't have a lot of people going, no, I want to work in 4 chairs at all times and run back and forth and never get to eat lunch.
Correct. Yeah.
Okay.
The 80 patient a day schedule is a dying breed. Yeah. Yeah.
Okay.
Yeah. Now, so for our purposes, let's go with that. Like that, it's going to be patient centric.
Okay.
And part of that also has to do with even the values of the insurances you're taking, right? Because look, it's about getting the patient healthy, but there is a cost to doing business, and so it has to be really efficient if you're going to participate in plans. And ideally, eventually you won't participate in plans, but even if you are going to, that affects your schedule, because if your crown is, $1,400, but you're going to get $700 allowed fee, well, guess what? We just cut in half the value of a hour to 2 hour procedure, right? So we have to factor that in.
Right.
Now, the first thing that we like to really emphasize is scheduling for patient experience.
Okay.
Customer service is primary here. If you schedule not enough time, that's a problem.
Right.
If you schedule too much time, it's like that, the proverbial new associate who does this beautiful 2-surface filling and it only takes them 3 hours. It's a beautiful filling, but the patient's never coming back.
Right.
Right. So what we like to do is have a proper balance and hygiene where the hygienist has time to educate the patient and talk to the patient and build rapport with the patient. It's not rushed, but it's not too long.
Right.
And there needs to be ample time for the doctor to come in, do the exam, and discuss any necessary treatment.
Okay.
As a stopgap measure, yes, you can always have them come back, but there's nothing, service-wise like scaring the heck out of somebody who had the courage to show up for their hygiene appointment.
Right.
Scaring them and then telling them to think about it for a week and we'll come back and talk about it. Right.
Right.
It's
Like
just-
obviously, if they don't have time to present today, they should bring the patient back.
Absolutely.
But yeah, we covered this in an episode recently in the sense of having consult time built into the schedule.
Yes.
But just to clarify that, because we have found some people will listen to that and go, "Oh, I got to bring everybody back for a consult."
Right.
No, that was never the idea. If you have time to present today, present today.
Present today.
But
Yeah.
if you don't, bring them back.
Yes.
Yeah. And I think for most, I don't know, I mean, maybe I'm wrong, but I think for most conventional, simple treatment plans, 20 minutes, 15 minutes, that's usually enough time for a smaller treatment plan. But if you're
Absolutely.
talking about an all on 6 or they need 3 implants and 4 crowns, then that's maybe a bit more of a discussion.
Absolutely.
Yeah.
Yeah. The size of the case. And that, again, it kind of goes back to what type of office. If you're going to be an implant center, we have some guys that are like heavy in implant. That's
Right.
a longer appointment. That's a lot more time.
Right.
It's, you're talking $50,000, $70,000 versus 3 to 7.
Right.
Now, a part of this also is I would generally suggest where possible, and I don't want to get into too many other subjects, doing quadrant dentistry.
Okay.
Where you can put appointments together. You like we talked about a minute ago, you don't want the appointment to be too long or rushed and too short.
Right.
Right. But usually the patient will appreciate a longer appointment if it means less visits.
You mind if I ask you a question about that?
No, go ahead.
Okay, good. So we were talking as we were going over this recently, points that we wanted to clarify with clients. And one was that consult thing.
Right.
Present now if you can, or otherwise bring them back.
That's right.
But the other was quadrant dentistry. And the first time I'd heard of that was 1992.
Yep.
So I'm thinking, well, everybody must be doing it now. But you're stating, like, you're seeing it, like docs that I've talked to, it hasn't really come up as much.
Yeah.
But you're seeing, especially with newer clients, that there are cases where people aren't doing that. So would that mean, just to clarify, so I have 2 crowns I need, but I also need 3 fillings. So am I being brought back for 2 appointments in certain cases?
Yes,
Wow, okay.
we're seeing that as a trend, and some of that is bad scheduling,
Right.
and some of that is actually it's all bad scheduling. The other part of that is not, and we kind of segue into our next point here in a second, but
Right.
it's having time to present and get the case accepted.
Okay.
Because if you're doing that and the treatment has been accepted and financial arrangement has been made, which I'm sure we have other podcasts about, but then now I can schedule like what's best for the patient, what's most efficient, and ideally schedule the whole treatment plan.
Right. That would make sense.
Yeah. And obviously because we're not doctors,
Yeah.
or I'm not a doctor, I should say, I say quadrant dentistry. It's really whatever you feel you can put in an appointment together to lessen the visits and make it easier on the patient is normally what we would recommend. And again, there's clinical latitude with that because
Sure.
what one doctor feels comfortable with might not be another.
Right. Obviously, the doctor has to make the call on that.
Yes. And even for hygiene, I would say 50-50. I would say 50% of our clients, their hygienists prefer to do all 4 quads on an SRP at one
Wow.
time.
Okay.
Because when they explain it to the patient, like, it's 1 visit or 2, which do you want? Most of them say 1, even if I'm going to be numb all over.
Really?
Right? Yeah. And, the other are like, hey, I just don't believe in that. And that's fine. This isn't cookie cutter, one size fits all, but it's just something to keep in mind as they're scheduling.
Especially like now with the COVID concerns that have been had. I mean, they seem to be lessening a bit now, obviously, versus the beginning of the pandemic. The less touch points you have,
Yeah.
the easier it is, not just on the practice, but for the patient. I think in most cases, you would see this works best for the patient and the doc.
Absolutely. It's
Yeah.
usually, go ahead.
No, that was
Usually it's fewer, and we're kind of getting ahead because it's a point we're going to touch
Right.
on more, but there's, when you schedule this way, there's fewer appointments
Right.
on the doctor side.
Right.
The production is higher and there's more dentistry getting done. And most importantly, there's more people getting healthy.
Right.
Yeah.
Yeah, I mean, I would appreciate that more as a patient. I could just say that personally. I mean, I guess it's all relative. Unless we were working on different areas of the mouth with it was a 9-hour appointment, then which that isn't going to happen. But you get the idea.
No, for sure. I'm the same way. I would rather have 1 appointment than 3.
Just get it done.
Yeah.
Yeah, I agree.
right.
Cool.
Yeah. Next point would be making sure, we kind of touched on it, that there's time to present treatment. You want to build in doctor time and hygiene. A lot of clients, what they'll do is you can assign doctor time for any type of appointment
Sure.
on your software. everybody has that. It's either X and slash or DNA or whatever, right? You don't have to do this, but a lot of our clients will actually do 1 to 2. We usually would do 10-minute units, doctor time for every hygiene patient that needs an exam.
Okay.
And maybe 3 for somebody that needs, because, really the hygienist, most usually pro fees an hour, depending on how many quads, maybe an hour and a half for an SRP.
Sure.
So it's pretty straightforward. I don't necessarily need to account for assistant time, right, or hygienist time in a hygiene appointment. Usually we go into accounting for the doctor time, so the doctor doesn't get overbooked, because it's a chicken and the egg thing with that, where if we don't have time to present the treatment, don't present it, don't get it accepted, well, then all of a sudden we're scrambling for production.
Right, or even for the exam. Because if they're doing a new patient exam, let's say they're scheduling 20 minutes for the exam.
Yeah.
Right? Maybe they don't have it built in to where they can do, because again, that's going to be variable too. You could walk in a room and a patient has no work needed at all. In which case, that was easy. Or you walk in a room and it's a huge case and you're not going to have time to close it today anyway.
Yep.
But remember, close it today if you can, if you have time. Sorry, just to clarify. Bring them back if you don't have time. Yeah. But if they're not accounting even for that 20 minutes, that could be just a pain.
Yes. Ripple forward across the patient experience, right? Because you're running late, you're going to be rushed, and somebody's going to get rushed. The procedure in the chair is going to get rushed, or the person who came for exam is going to get a rushed, come back later. Right. And look, that's, it's last time I looked, which might have been 2 or 3 years ago, but by survey, dentistry was, I think, the number 2 fear in the country, right? So when you talk about people showing up and then telling them, okay, show up again, where it's necessary, absolutely that is what you should do, right? Sure. But you want to make it a pleasant, happy experience when they're there. And I don't want to tangent too far into customer service, but schedule's a big part of that, right? It's, if you go to a nice steakhouse, they don't pass you through drive-through. Right.
I think that's also too that new patient, because we're talking primarily about a new patient.
That's
here.
right.
I mean, not that you would have terrible customer service for your patients of record. That would be kind of a waste, right?
Yep.
But with a new patient, this is their first contact with you. So if I'm there and my appointment ends at 2:00, I know I'm scheduled for an hour, right? And the hygienist tells me the doctor should be in shortly and it's 1:40. Yeah. The doc doesn't roll in till 1:55 and is now running over. It's just bad.
Yes.
Yeah.
Yeah, you don't feel important that way.
Right. It just sets a bad precedent to start the relationship, because I don't really have that much of a connection to the doc at that point.
Right.
Yeah.
Right. And
good point.
One other thing on that note, I would just say is, and this is just sort of an interjection, especially with the last couple of years in certain areas, some areas they're finding a hard time to find hygienists, right? Which, again, could be its own podcast.
Sure. We did that one.
We did that one.
Yes, we did.
Yeah. See the podcast on finding a hygienist, because
finding
you'll find
a hygienist, and we have a video for it too. So we have like a series of 6 escalating steps. I think that ends, if I'm not mistaken, with bulk emails or mailers to every hygienist in your state. So
beautiful.
It can happen.
So yeah, you can find a hygienist, but if you're shorthanded in the moment, we've seen more and more people again go back to sort of assisted hygiene, where the hygienist has an assistant, works on a 2-column. And listen, if you have somebody out ill or short term, I don't have an issue with it. I don't have an issue with it generally. But again, it's that patient experience. What we find for offices that do that for months in a row is their retention rate drops.
With the assisted hygiene.
Yeah. The amount of patients, magically, the amount of patients that need perio drops dramatically.
Interesting.
And, it's just patient experience. People aren't getting the time, attention, and education that they need, in spite of some heroic effort.
Right. Well, the hygienist, while they're taking those x-rays and doing the perio probing, they're talking about stuff.
Right.
Whereas the assistant would do the perio probing, or would not. But while they're doing it's not the same conversation.
No. And when you're like, I have to be over there in 10 minutes or 20 minutes, it's not the time that you'd like.
Right. That makes sense.
Now, one thing that we like to do, and this kind of goes back to having time to present, right, is also having time for new patients and for consults.
Okay.
And, you're going to look at your office. You're going to look at how many new patients you get a month. You're going to look at realistically, if you want to increase that, how many you're going to increase it by month. The normal rule would be ideally 24 to 48 hours for a new patient.
You're saying for the new patient visit?
Yeah, to get them in, like to be able to get them. I should rephrase that you could get somebody in within 24 to 48 hours.
You're saying as I call your office, hey, I just moved to the area. I'm looking for a new dentist. I need to get my teeth cleaned.
Yeah.
You want me on the book in 24 to 48 hours.
Yes.
Right.
And the issue that we find with that, first is just the show rate drops dramatically after the second or third day. If I'm scheduling somebody for a week from now, I'm going to do everything to make sure that they show up. I'm going to confirm them. If you're asking me personally, 50-50 chance they're going to show.
Right.
You're coming in, you called me at 2, you're coming in at 4 today. I bet 90% chance you show.
Right.
Right. The other thing is a lot of times the more urgent things do require same day or next day. If somebody's calling you with a toothache, which a lot of times if I don't have a dentist, that's why I'm calling a dentist. Like I'm finally confronting doing that because I have some health concern.
Right.
So getting me in, it's just good service.
Right.
It's, no one likes to be put in a queue to wait. In any aspect. And then consults, like if you run out of time or you're doing bigger cases and sometimes you run out of time, you want to have time booked for that. And that's great to make sure you have enough to present, to make sure that you're going to produce enough, but also so that, it's not where I say, hey, listen, we're going to start with handling your gum disease and it's going to be this, this, and this. But listen, you've got some stuff going on structurally when you come back we have to talk about.
Right.
And
you don't like that flow.
Well, look, if I have to, kind of like we're saying, if it's a big treatment plan, fine. But then why don't you come back in mid-April and we'll talk about it?
Now, do me a favor. I know because you just said a lot. If you don't mind, could I unpack a little bit of what you said?
Yeah,
for a
of course,
second?
absolutely.
I've had this conversation with a new client or a non-client before. I'm gonna just unpack those points because these are key points. So you're talking to the listener, you're saying, yeah, listen, you have to get a new patient initial in 24 to 48 hours. That's what you're saying.
Yes.
Okay. So now, who sees the new patient initial? Obviously, the doctor is going to have to do the initial exam, but they could be scheduled with the hygienist to do that stuff, or some people like to have them see the doc. Fine, right?
Yeah.
Doesn't matter. Doesn't matter to us.
Yes.
But so I'll explain that to somebody, and they'll go, well, I just don't have time in the schedule. It's just I don't have time. And it becomes this huge problem. Like I've talked to people that are new patients are booked out 3 weeks.
Yes.
And there's this idea that that's a good thing. Oh, my schedule's full. But as you say, which is completely 1000% true, the longer you push them out, the better chance they're not going to show, especially as a new patient. I have no connection to them.
Yep.
And I've called to schedule an appointment unless I'm a referral and they can't get me in for 3 weeks. I'm probably calling the next office.
Absolutely.
If I don't want to come in for 3 weeks, that's a different story.
Right.
Right. But so how would you solve that for somebody? So I'm just slammed. My hygiene is booked out 4 months in advance and I have an opening once in a while and I see a new patient initials in hygiene, let's say.
Okay.
What do I do?
Well, there's a couple things you could do on an immediate basis. Even if I like them to go on hygiene, if hygiene is booked, I'm going to block maybe the first appointment in the morning and the first appointment in the afternoon each day for either a consult or a new patient.
Okay.
So I start to give some easing, right?
Okay.
And if you're that booked out, you really should be probably looking at adding hygiene days.
Of course.
I would always like to be, when you're looking ahead, it's always easier to be proactive and have it open. There's a little bit of an element of, build it and they will come, right?
Sure.
When you open those days will fill almost always.
Right.
Right. People always think, well, wait, I have to wait till I'm really booked out. It doesn't really work that way.
Right.
So
you're saying if I can't find time in the hygiene schedule, maybe I could block some time out when it's coming up in the near future.
Right.
Then block in the doc schedule.
Yes.
Okay. Like first thing in the morning, like we talk about putting consults first thing in the morning or first thing after lunch.
Yep.
What if there's no consult to do today? I'm seeing a new patient.
Absolutely.
Okay. Fair enough.
Absolutely. And usually what we'll do is fairly early on have the client look at, okay, so how many new patients, I'll just make my math really easy here. Let's say there's, 4 weeks, 5 days a week. So 20 days, 40 new patients. So you're going to need to allocate 2 new patient visits a day on average in hygiene.
Okay.
And that's just how you book it out.
Okay.
And then you also take that into account with your active patients and how many hygiene days should you have and
All that jazz.
yeah, and all that jazz to make sure, okay, well, boy, then maybe I need to add a hygienist. Or you know what, we're good. Maybe you're a scratch practice.
Right. So that's perfect. That pretty well unpacks what I wanted to unpack there because I knew I would get that question. If I said that to somebody, 50% of the time, the next question I'm going to get is, well, where do I put them?
Yes.
Yeah, no, that's great.
Yeah.
Okay, good. Sorry.
Great.
I just wanted to throw that in there real quick.
No, it's a perfect question. Now, normally you're going to want to have some type of policy on how to schedule production.
Okay.
And again, this is so relative to how the doctor as a provider likes to operate, what procedures they do, you know, and we have literally a variable of almost 300% time with like certain procedures between one and another. You know, one guy will do it in
Right.
in an hour, start to finish, out the door. Another guy takes 2.5 hours.
Sure.
Both very successful dentists. It really doesn't matter.
Sure.
What matters is that it follows your philosophy. So that said, you want to have some policy to make sure like these other points we've talked about are in place. And normally what we will recommend is a balance of high, medium, and low value production, right? And I think, you know, we cover that pretty well in the scheduling seminar, right?
Right.
But that's not a new concept, right? It's just you'll hear that out there, and it's really the thing with it is the execution is really having it in place, really having it be followed, and I think also being specific enough with it about it. Right?
Okay.
Like, you know, if I just say, well, high value is blah 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 blah, and I don't really do the math on it. You know, it's kind of like we go to like a crown is high value. And now I'm not trying to upset people who mill. A lot of great clients of ours that mill. Some of our clients teach milling, right? So I'm not anti-milling when I say this. I'm just going to make a point, right? If I do an $800 crown and if I'm sending it out to the lab and I'm going to do it in 60 minutes, let's just say that's a very typical time.
Sure.
Start to finish.
Sure.
Okay, it's $800 an hour. Let's say I'm going to keep the patient in chair and I'm going to mill it. And let's say, you know, I would say most of our clients that mill go a little over 2 hours, but let's say 2 hours. Now that appointment is a $400 appointment per hour.
Right.
So, and listen, that's not a bad thing. It's just when you're scheduling and determining what are you going to have where, you have to think with times, values, insurances, to make sure that you're achieving your goals in terms of helping as many people as you want to help.
Well, it's an interesting concept mathematically too, because now lab fees have dropped so dramatically. I mean, they're going up a little bit with inflation recently. But if I'm going to spend, I don't know, anywhere from $60 to $120 with a lab, and then bring the patient back, assuming it's a good lab, it fits well, and the scan or impression was really good.
Yeah.
That should be done in a half hour or so.
That's right.
Yeah. So I've taken an hour and a half versus 2 full hours, and I spent $127 on top of, well, you're making the payment for the machine anyway. So you actually, it's better. Okay, good. We'll just drop that on the whole milling issue.
Yes. A lot of our milling clients very quickly go fee for service, and that's a great way. If you're passionate about milling, you can absolutely make this work for you 110%. It's just you have to think it through a little bit more.
Yeah, it doesn't work with the PPO fee schedule.
Does not work with PPOs.
Well, and that's just, and we brought this up recently in seminars and episodes. Like one thing we're trying to program all of our clients out of now is out of PPOs because it's just not going to work long term.
Yeah, I mean, just the fact that we're talking about it, Jeff, that like that the insurance would dictate what clinical preference the doctor should have because the fees are going to get cut.
Right.
You know, it's
messed up.
It's messed up.
Yep.
And so tying in with scheduling for production, you know, a full schedule. I hate full schedules. I'll just say that right now. I hate full schedule. I love a full schedule in hygiene as long as, you know, the appointments are long enough to give us time to give the great patient experience and time to present treatment. Boy, on a doctor side, it's a pet peeve for me, right? Because
so you want you want some open time every day.
Oh gosh, yeah.
Oh wow.
Gosh, yeah. Because that's when it's productive. If I load you up with 16 patients, forget about it. You're on roller skates the whole day, probably taking oxygen over your 5-minute lunch because you're not going to have time to eat. And most importantly, not very many people are going to get healthy. Not in hygiene because you don't have time to talk to them.
Right.
And you're doing a lot of single procedures, single unit procedure.
Right.
And so you're doing a lot, oh, great. Okay, come back again, come back again, come back again. And when you lengthen that runway, the greater chance there is that it's just not going to work out.
Right.
Right. Meaning something, life intervenes and the patient doesn't get through the whole treatment plan, even if they're committed to doing it.
Sure.
And it's not, it's not a great patient experience. It's not a great staff experience. Those offices usually run through lunch frequently. They usually run late.
Right.
Which again, it's in healthcare, you're always going to do that sometime. But, most doctors have kids or families.
Sure, and your staff have kids.
So do your staff, right? Yeah. So I'm all about if you stay late occasionally to help somebody who's an emergency or take care of a big case that is timely, but like as a usual operating basis, there's just no reason to have to do it.
Right.
So I would schedule efficiently, schedule like we've talked about, have your high, medium, and low value time, have those values determined and named out, clearly spelled out for whoever's responsible for the schedule that way, keep it simple. Honestly, I would, for me personally and most of our clients, if I have high value time that's open, I'm not filling it even a day of, because normally at least half my patients in hygiene need something.
Yeah, it's an interesting point you bring up, because I know that this was one of those clarifications we were talking about,
yes.
right?
Yeah.
Like the consult thing and whatever was the high value issue.
Yeah.
Because we even changed the terminology in our scheduling seminar, because it used to say, did it say high? We changed it to high value, right?
It was high value procedure. We changed it to high value appointment.
Right, high value appointment. Yeah. Because if someone needs 6 composites, that's technically got a higher value appointment at that point.
It very much could be, yeah.
But then someone could look at it literally and go, well, high value procedures are just crowns and implants and veneers and this and that and whatever, inlays, onlays. So they take that procedure, they make it a secondary procedure, as opposed to, no, that could fit in the morning. So it's really the value of the appointment itself as opposed to the procedure itself.
Absolutely. Yeah. And it becomes the hunt for the white whale.
Right.
To like find the high value. And instead it's just, we just do our usual, and it's okay to have some openings.
Sure. But now what you're saying, just to speak to your point, sorry.
Yeah.
So, because you had mentioned something else that I found intriguing there, which was specifically, so you're saying if I have, I don't know, let's say my primary time, that's when I'm doing my high value appointments.
Yes.
Okay. So let's say my primary time is always in the morning. Okay, I have my consult time in the morning for 40 minutes to an hour.
Yeah.
And then I've got 3.5 hours of primary time.
Yes.
Okay. So I've got an hour open in there, or an hour and a half open in there. So what you're saying is you're not going to fill that even the day of, right? Because there's a chance I could probably find somebody who needs something in hygiene. And there's also a good chance one of those consults I see in the morning could stay and do the appointment if they're off work that day or something like this.
That's right.
Interesting.
Yeah, it's that old game of chicken where it's the first one that turns loses.
Sure.
And what we find is as soon as you say, you know what, if it's 4:00 the day before or 12:00 the day before, just go ahead and put something in there. And then, the client comes to us and like, gosh, I'm really plateaued and I'm so busy and I'm running late. I don't have time to do anything, and and it's kind of miserable. Right. And what we find is they're clogging up that high value time with medium value stuff, right? And then when somebody comes in with an emergency, a true emergency, because it's coincidental, but maybe not, that the high value procedures are also usually the most urgent to health.
Sure.
So, I'm booked out 2 weeks, or I'm booked out 4 days or a week, but I'm booked out with fillings in my high value time.
Right. Interesting.
So we like to have openings. We like to have time, and on that, now this would not be for everybody, but depending on your size, a lot of times when clients first start implementing this, I will tell them, no, or we will tell them, I don't want to see a single appointment on your schedule under 1 hour.
Interesting.
And the reason for that is too often we schedule it based on, well, the doctor can do this in an hour. Yes, if he doesn't have a hygiene check, if he doesn't have a patient in the chair next to him, and next to the other patient, then he could, but otherwise it's not. And then we get into, like we were talking about earlier, bad patient experience.
Right.
We're running late. So it's okay. Like, you look, if the patient thinks it's going to be an hour and a half, and if the hygiene exam doesn't need any work and the patient gets out an hour and 10 minutes, you're a hero.
That's true.
Right. But if you're going to sell a $5,000 case in hygiene and the patient still gets out in 90 minutes, now everybody wins because the hygiene patient got healthy and the patient got in and out as promised. Right. So scheduling for the whole schedule, and what tends to happen, and I don't mean this forever. I mean, as you're organizing your schedule, I'll put in a adjustment or post-op.
Sure.
30 minutes. Then I'll put in another one, 30 minutes, and I'll have 2 or 3 back-to-back-to-back 30-minute appointments. What happens? Come 3 o'clock when I have those 3 back-to-back-to-back, those dictate my schedule.
Right.
Got a guy in the other chair. He wants to do the other crown that we proposed. I don't have time because I got these 3 post-op checks.
Right.
I'd love to sell this case to this new patient. I'm going to have him come back for a consult. Why? Because I have 3 post-op checks. It's the same deal. Yes, it's going to take you usually 10 minutes, but it is relevant to say, just as an aside, the way that we would teach you to schedule, you would also have an assistant in each room. So I'm not talking about leaving a patient by themselves in the room for 20 minutes.
Right.
But when you're expected to be in and out in an hour, and you're in and out in an hour, that's generally satisfied. Usually you get out,
that's true.
Earlier than that. But that way, that appointment doesn't affect the rest of the schedule, because those little no-charge appointments so often affect the whole schedule.
And you can do them efficiently.
Yes,
I guess
absolutely.
the problem is, because you and I do most of our scheduling seminar, the
Yes.
big one for clients, and it's not something that would translate very well on a podcast. Here, look at this block here, and it's not going to work, right?
No.
We do have videos on it, like we have the scheduler training on our online platform, DDS Success. We also have, if you're not an MGE client, you want to find out something about this. I normally try not to do this during the podcast, but I thought it was appropriate that we do a free seminar, and it's done virtually, called The Art of Scheduling Productively.
Yeah.
Where you can find out more. If you're an MGE client, you should come to the Scheduling for Production seminar. That's where we lay out the whole system. It's 2 days long, but I didn't think that would translate super well with the, X and slash or DNA and whatever, right?
Yes.
But just to your point, I want to just throw that in there if I could.
Yeah, no, I think it's a great point. And, it's with these appointments, it's just even like a consult, Jeff.
Sure.
Like, I would like to make that thing an hour. Again, maybe it's in and out in 20 minutes, and they're like, thanks, no, or maybe they're a sign up. But
I think the trick with that, though, where it could get tricky is, again, because obviously consults are subjective, right?
Yes.
Let's say I just ran out of time, things went wonky, and a patient needs 3 crowns, right? It's a $4,200 case. I can't present it today, so I bring them back.
Sure.
I could probably get that done in 20, 30 minutes, right?
Absolutely.
But
And
sorry.
I'm sorry, Jeff. You might not even need to put that in a chair.
Right.
I'm saying more if you put it in a chair, but go ahead.
No, but I see what you're saying, because otherwise it's very funny if you don't know how it works, and it's sort of like opening Pandora's box. Like you brought up, because we talk about primary time in the mornings.
Yeah.
That's where you're doing high value procedures, appointments. Sorry. High value appointment. Got to get that terminology right, Chris. Sorry. But if you then tell, because you mentioned this, you go, oh, well, your policy is if you have an opening, let's say today's Tuesday, you have an opening on Wednesday at 11 o'clock, which is primary time, and you have no primary appointments to put in there, right? Primary type procedures or appointments. You can fill it with anything. Right. That's the office policy. Well, then what happens? You walk in and at 11 o'clock, you're doing a denture reline or, something,
That's right.
Or 2 occlusal composites or something like this, because they filled it with something.
Yep.
Right. So I agree with that. And I agree with because if the idea of an hour consult or just having simple procedures to follow, because once you throw these little ideas out there, if people aren't really conversant with how the whole schedule is supposed to work, it's almost too much change at once.
It's a really good point, Jeff. And I like these things that we're talking about. I would start very basic,
Right.
very simple. And if you're an MGE client and you've been working on your schedule and you've implemented a lot of things, some of these things I'm saying might not be things you would do.
You might be ahead of
well, with like consults or nothing under an hour, you would have consult time, but meaning like that they should all be an hour. Like
but even let's say I did that, I have an hour consult this morning.
Yeah.
Okay. And the patient agrees to do the treatment after 40 minutes.
Yeah.
Okay. So what? I mean, I'm happy. They're happy. They're going to do the treatment. I mean, heck, I might even be able to start something now, time allowing, especially if there's like if it's in for an Invisalign case or something. I might do the whole thing right now, right?
Yes.
But I agree with this. You're better off making sure you have adequate time to do it right, rather than. But then back to your original point, if the fee schedule is all whacked, then that doesn't work.
Right.
Yeah.
And then then you get into policy on that, which
Right.
Is its own could be its own podcast.
Absolutely.
Right? Yeah. So full, and let me be clear about something. Full schedule on what we like is full schedule on hygiene, right? So it's kind of two things: quantity. Like we want hygiene full,
Sure.
with enough time to do what you need to do.
Sure.
Hours fine with me,
Sure.
and fine with most people. Doctor side precision is what we want, right? And so it's just kind of quantity on one side, quality on the other. Quality of scheduling, and I think so you'll have some holes on doctor, not on hygiene, ideally, right? Now, another thing that comes up is like how to execute the schedule and what to do if you start running behind,
Okay.
because this is usually where, for lack of a better way, sometimes staff will go rogue. Like, what are they going to do? Right. So it's good to have some simple policy like, hey, when will we squeeze in an emergency? When will we not? When will we opt to do same day treatment? When will we not?
Sure.
And it's good to have that kind of policy. And it's also because it's healthcare, right? So, if you're assembling, water bottles, you probably don't run over very often. I would
Right.
hope. It's, healthcare, you're going to run over. So a lot of clients also will even have a rotation like, okay, Tuesday and Thursday, if we have an emergency, if we run late, this assistant is going to stay.
Okay.
And then Monday and Wednesday, if we run late, this assistant's going to stay. Or they take turns, right? But a lot of times it's easier like, okay, Tuesday and Thursday, I know, or my husband or my wife knows, I might text them if I get caught with a patient late to go pick up the kids.
Sure.
Or pick up dinner.
Sure.
Right, or whatever. So having a policy on that, having a policy on how when you have new patients, and just a few basic policies can make it really simple through the day. And also, ideally, just having one person that everything funnels through for the schedule that isn't somebody who's got 8 other jobs in the office.
Right.
We're very big on having a scheduler.
Right.
That's all they do, and I think that's something that you should work toward. But if you have 3 staff, it might be a little while before you get to that point.
Sure.
But if 3 people, it's kind of the analogy. If I could have 3 great chefs, if they're all making the same meal at the same time in the same pot, it's probably not going to come out very well.
Right. One person has to be responsible.
Right. So, having one person responsible for the schedule and those changes go, even when it seems annoying, like I'm the assistant, I can just add the treatment to the procedure right now, or add the treatment to the appointment right now. No, have the scheduler do it. Takes 30 seconds to a minute, but we keep that point of control.
No, that makes sense.
And then the other thing that is often missed is usually when a patient gets upset for waiting, it's not because they're upset about waiting. It's because no one told them.
Okay.
There was no, hey, listen, Dr. Smith's handling an emergency. He would do the same for you. Just want you to know we're running about 10 minutes late. We're going to do everything we can to still get you out on time. 99 out of 100 times, the patient says fine.
Right.
It's when you don't say anything. Oh, I'm worried about the patient's reaction, or, maybe I'm not sure what to say. And this is, again, having a policy. What do we tell a patient when we run behind? That's when now the patient's annoyed. It's like 15 minutes and they're looking at their watch,
Right.
and they're texting, and they're like,
Well, bad form really is if they're coming to you first.
Oh, yeah.
Hey, it's been, it's 10 minutes past my appointment time. Am I going to be seated? Because you see that. And it's something, not to go off beam here, but I've seen this especially post-COVID. I don't know if you've had this experience too.
Yeah.
It seems like customer service, I don't want to be generalized, but it seems like customer service has taken a serious hit. Just with everywhere, like restaurants or the people you call. I was just talking to Sabri about this the other day. I was calling somebody. I'm just, this is ridiculous. It was an insurance company, not health insurance. I know they're horrible, right? But it's like car insurance, right? Calling the company, and it's the amount of stuff they're automating as opposed to just helping me.
Yes.
You see, and I think that's a thing now.
It's absolutely.
Yeah, it's just now it's okay to have terrible customer service because we can just blame, we don't have any staff or we don't have this or don't have that. But yeah, you're right. That's they're not coming back.
Right. And it's a little bit of communication. People think it's like, oh my gosh, I have to be a mass. No, it's common courtesy. Most of us, if we were going to be 15 minutes late to meet somebody that we were friends with or business associates with, we would text them.
Of course.
And that's all we're talking about. Now, I mean, obviously, if they're in the waiting room,
you're not going to text them.
Right?
when they look at their phone, you duck.
Yeah. But, it's simple communication.
Sure.
These little things go a long way. And most of the time, the patient will be totally fine with it.
Right.
Yeah.
Yeah, that's cool.
Good. Yeah, and I think, Jeff, that really covers the points that I would start with on this.
Okay.
And it is always going to be a fluid activity, right?
Mm-hmm.
There is no such thing as, unfortunately, as I fix my schedule and it's perfect forevermore.
Right.
This is, you fix it in layers. And right now, I would take a few basic things that resonate with you for your office. I would implement them, see a change, then do the next few, do it again, and focus on patient experience. And you'll see changes in your office, and most importantly, you'll see changes in the result with your patients.
No, that's awesome. And Chris, it was a pleasure having you on. We'll be doing more podcasts together in the future.
Awesome. Thanks for having me, Jeff. I really appreciate it.
And I think that about does us for this week, guys. I hope that helped. And if you have any questions about MGE, we do offer a free practice consultation. You can call us at 800-640-1140 or find us online at mgeonline.com. And if you like the episode and you'd like to hear more like this, don't forget to follow or subscribe to the episode depending on the podcast platform you're listening on. Guys, thanks so much, and we'll talk to you next week.